I think I know the answer, but I would like you to share with our audience what you think the answer is for us to get healthcare back into the place it needs to be in the free market.
Well, the first thing I think we have to acknowledge is the government caused this mess, and so we cannot look to them to solve it. I would argue the system is working exactly as it was designed to work after all of these favors have been auctioned off in Washington, D.C., and people are making off like bandits. I've said recently that we shouldn't look to Uncle Sam to solve this caper when Uncle Sam's driving the getaway car.
Right.
So they're part and parcel of the problem. Part of the answer is to remove government from the equation, because the state in all of its forms is the antithesis of free exchange. You know, the government is that entity whose ideas are so wonderful they have to be mandatory.
Right.
That's not mutually beneficial exchange. So if you pull the government out, and then you can begin to have free exchange between buyers and sellers. So the answer is to get government out as much as we can. The answer is for people to, in the business like me, to say, here is what I do, and here is what I believe I should be paid for it, and then let the market judge me. And the answer too is not necessarily the same answer for everyone. So whenever someone in Washington, and they do this now, they call me, and what should we do? And I tell them to simply stop. Whatever it is you're thinking about doing, just don't do that, unless it is repealing something you've done in the past. And then, like William Wallace says in Braveheart, and then leave town and beg for forgiveness at every little house on the way. You know, what should we do? You should just stop. You should not do anything. I'm not interested in anyone's plan for my family's health care. We'll make our own plan.